Tumahimik. Para 30 seconds. Ready. Okay, good afternoon, everyone. Good afternoon to the viewers, to the audience here at Mercury Drug Corporation in Glorieta, and to everyone watching at Facebook. We're live right now. Good afternoon to you. Today, we will be discussing about the ABCs of diabetes care. I am Dr. Mia Fojas. I am the immediate past president of the Philippine Society of Endocrinology, Diabetes, and Metabolism. And this afternoon, we will be discussing the following: diabetes and its pathophysiology, symptoms of diabetes, diagnostic criteria of diabetes, different types of diabetes, complications of diabetes, and the management of diabetes. Puro diabetes talaga. ABCs nga. Anyway, let us go to the definition of diabetes. As you can see here, diabetes is a chronic disease which has been described as a state of raised blood glucose or hyperglycemia associated with premature mortality. Hyperglycemia seriously damages many of the body's systems, especially the blood vessels and nerves. What does this mean? Diabetes mellitus is a chronic disease, pangmatagalang sakit, described as a state of raised blood glucose or mataas na asukal sa dugo. And dahil sa mataas na asukal sa dugo, maraming posibleng organs na masira sa ating katawan. So, ano ang pathophysiology o paano nagkakaroon ng diabetes? Una sa lahat naman tayo ay kumakain. When you eat, your body breaks down food into glucose. Glucose is a type of sugar that is your body's main source of energy. Kailangan natin lahat ng glucose para magkaroon ng enerhiya, para tayo ay makagalaw at makaisip. Ngayon, as blood glucose rises, the body sends a signal to the pancreas, o sa Tagalog yung lapay, na nagre-release ng tinatawag na insulin. Ano ang insulin? Ang insulin acts like a key, o para siyang susi that binds on the cell wall or an insulin receptor, unlocking the cell so glucose can pass into it. So para siyang susi ang insulin para makapasok ang asukal natin sa dugo papunta sa bloodstream natin o kaya sa different cells, so iba't ibang bahagi ng katawan. There, most of the glucose is used for energy right away. And now, let's go to the symptoms of diabetes. Ano ang mga nararamdaman ng pasyenteng may diabetes? Maaari siyang magkaroon ng polydipsia, polyuria, polyphagia, at weight loss. So, ano ang polydipsia? Ang polydipsia or increased thirst, laging uhaw, yan ay dahil sa mataas na blood sugar or asukal sa dugo na nagko-concentrate sa dugo. No? It increases the concentration of blood. Kaya medyo nagiging parang malapot din yung dugo ng mga pasyente ito kung hindi sila uminom ng maraming tubig. Polyuria naman, yung increased frequency of urination, madalas umiihi, due to excess fluid intake and glucose-induced urination. Ano ba to? Normal to, no? It's a protective mechanism of the body kasi ang polyuria, iniihi niya pati yung asukal na excess sa katawan natin. However, in the process, nagkakaroon ng konting sira sa kidneys, or pangalawa, nadi-dehydrate ang pasyente. Okay? Polyphagia is excessive hunger and eating. When insulin levels are decreased or there is insulin resistance, the cells of the body do not get enough sugar and hunger develops. Ito napapansin natin sa mga diabetiko na parang kain sila ng kain. So hindi natin din sila masisisi dahil nagugutom sila. kahit na marami silang kinakain, yung katawan nila parang nade-detect na kulang pa rin ang asukal ko sa katawan. So, kailangan natin kumain dahil kulang silang sa insulin o kaya hindi nagte-take ng insulin yung yung muscles nila at other parts of the body. So, in effect, nagugutom pa rin ang katawan nila kahit na kumain sila ng marami. So, hindi pwede natin sisihin ng mga ibang diabetiko na poor ang sugar control dahil madalas silang kumain. It's a sign na pangit pa yung sugar nila. Symptoms. Another symptom of diabetes is weight loss. People with polyphagia often lose weight. Kain sila ng kain pero nangangayayat even though they are eating more than normal because the excess calories are lost in the urine as sugar or as glucose. So, ayan, kung minsan yung ibang mga pasyente napapagkamala ng parang nagka-cancer, may sakit ka ba? Dahil parang ang payat mo ngayon. Yung pala, sudden weight loss ito. Hindi yung intentional, no? Yung hindi yung nag-dieta, gano'n. Kahit sila nakain pero pumapayat. So, para natin malalaman or how do you diagnose diabetes? Ito yung mga laboratory tests. First, the fasting blood sugar. The normal fasting blood sugar should be less than 100 milligram per deciliter or 5.6 millimoles per liter. Beyond that, pag 5.6 to 6.9 millimoles per liter or 100 to 125 milligram per deciliter, yun yung tinatawag na impaired fasting glycemia or impaired fasting glucose. So, mas mataas siya kesa sa normal, pero hindi pa siya nasasabing diabetic. Okay? Pag diabetiko, ang fasting blood sugar ay more than or equal to 7 millimole per liter or more than or equal to 126 milligram per deciliter. So, hindi lang fasting blood sugar ang magiging basehan ng diagnosis ng diabetes. Meron ding tinatawag na 2 hours postprandial or 2 hours post 75 gram oral glucose tolerance test, no? Ito naman, pag after, pwedeng anytime within the day, pwedeng tinatawag na random blood sugar. Pero ito, after 2 hours na binigyan ng napakatamis na solution na 75 grams ng glucose, ang blood sugar should be normally less than 7.8 millimoles per liter or less than 140 milligram per deciliter. Pwede rin itong kunin sa mga taong kakakain lang. Hindi kailangan ng 75 gram oral glucose tolerance test. But strictly, kung kailangan nating i-determine na talagang diabetico yung isang pasyente, pinagagawa natin yung oral glucose tolerance test. So earlier, sinabi natin impaired fasting glucose ay 100 to 125. Ngayon, after 2 hours, ano naman yung impaired glucose tolerance? Ito naman yung 2 hours postprandial na may 7.8 to 11 millimole per liter or 140 to 199 milligram per deciliter na sugar. Pag lumampas ng 11 or more than or equal to 11.1 millimole per liter or more than 200 milligram per deciliter, yon ang tinatawag na nating diabetiko. Meron pang isang test, hindi siya masyadong marami no, sa ibang probinsya, pero dito sa Metro Manila, ginagawa ang glycosylated hemoglobin or hemoglobin A1C. Ito yung nakakabit na blood glucose doon sa red blood cells ng pasyente or sa ating lahat. So, ito yung hindi nadadaya. No? Kasi yung iba, pwedeng dayain ng fasting blood sugar, lalo na kung matagal na hindi kumain, no? Pwedeng, akala nila, madadaya itong HbA1c, hindi. Kasi non-fasting, kahit non-fasting, pwedeng kunin ito. Ang normal glycosylated hemoglobin, or A1c, ay less than 5.7%. Ang pre-diabetes ay 5.7 to 6.4%. At ang diabetiko ay more than or equal to 6.5%. So tatandaan po natin itong lahat ang FBS, 2 hours postprandial, at yung hemoglobin A1C. Hindi lang isang beses ang pag-diagnose ng diabetes, no? Maaring 2 beses kayong kumuha on different days ng fasting blood sugar, or pwedeng any time of the day, no? Kung nakakuha ng more than or equal to 200 mg per deciliter na blood sugar, high likelihood na diabetico po kayo. So, ganun. Ano-ano ang iba't ibang types of diabetes? First, there's type 1 diabetes. This is when the pancreas does not produce any insulin or produces very little insulin. And next would be type 2 diabetes, when the body does not respond appropriately to insulin, a condition called insulin resistance. Going back to type 1 diabetes, in type 1 diabetes, the insulin-producing cells of the pancreas, called the beta cells, are destroyed. So, hindi enough or no insulin is present, or very little insulin is produced by the beta cells that are remaining. And patients use insulin injections to control their blood sugar. Ito yung mga pasyenteng habang buhay na talaga mag-insulin. Ang type 2 diabetes naman, may insulin siya. Insulin is produced, but it's either not enough, or the person's body does not respond normally to the amount present. So, gaya ng sinabi ko kanina, posibleng hindi pumapasok yung susi doon sa tissues, kaya hindi makapasok yung blood sugar. So, glucose in the blood cannot get into the body cells for use as energy. So, yun yung mga type 2 diabetes, at yun yung mas maraming Pilipinong meron. Merong maraming type 2 diabetes na Pilipino. And lastly, it's gestational diabetes. Ito naman, high blood sugar level that starts or is first recognized during pregnancy. Blood sugar levels usually return to normal after childbirth, and patients have increased risk of developing type 2 diabetes later in life. So ito, mga pasyenteng nagbubuntis, no? Lahat dapat ng mga Pilipino, high risk kasi tayong mga Pilipino sa diabetes. So lahat dapat nasi-screen for gestational diabetes kung nagbuntis. Okay? So you don't have to wait until 24 weeks of pregnancy. At first consult, at least check for using the 75-gram oral glucose tolerance test sa mga pasyenteng buntis. Pero usually, pag nanganak na sila, nagno-normal ang blood sugar. However, during pregnancy, there might be, kung hindi makontrol ng pasyente ang blood sugar niya through diet, there's a high probability na mag-i-insulin siya. Hindi tayo masyadong namimigay ng oral medications during pregnancy. So really, kung gestational diabetic, mas magandang naka-insulin para rin po yan sa baby. What are the long-term effects of diabetes? The long-term effects of diabetes can be divided into two: the macrovascular complications and the microvascular complications. Macrovascular complications affect the larger blood vessels, such as those supplying blood to the heart, brain, and the legs. So, sa coronary artery disease, yun yung macrovascular complication, yung mga inaatake sa puso. Tapos doon naman yung stroke, yun naman yung sa brain, yung tinatawag na kung may heart attack, ito naman brain attack. So, yun yung mga iba't ibang komplikasyon due to diabetes. Sa microvascular complications naman, these affect the small blood vessels such as those supplying blood to the eyes and kidneys. Pag nagkaroon ng microvascular complications sa mata, ito yung tinatawag na retinopathy, sa kidneys, nephropathy, at sa nerves, neuropathy. Ang retinopathy, hindi yan, wala yung masyadong symptoms, no? Halimbawa, pag bulag ka, mabubulag ka talaga. Nakikita yan sa likod ng mata natin, hindi madaling i-diagnose. So routinely, lahat dapat ng mga diabetiko na si-screen for retinopathy. Sa kidneys, yung nephropathy naman, nakikita yan kung may komplikasyon at first, no? The earliest sign is posibleng may protein doon sa iye. Sa routine urinalysis, maaring makita yon kung may albuminuria. Sa nerves naman, minsan hindi yan pinapansin, no? Kung minsan nagkakapagmamanhid sa mga daliri at paa, yung iba naman parang may tumutusok-tusok. We'll describe all of these things later more in depth. Other complications of diabetes would be peripheral vascular disease and poor wound healing and other infections. Peripheral vascular disease is an abnormal condition that affects the blood vessels outside the heart, usually the hands and feet, often occurring as a result of decreased blood flow and narrowing of the arteries from atherosclerosis. Ano ba ibig sabihin nito? Ang haba. Mga diabetiko po na matataas din ang cholesterol, yung cholesterol pwede magdeposito yan sa maliliit na blood vessel o maliliit na ugat na nagsusupply ng dugo sa mga, especially paa at daliri. No? Pag nagkaroon ng mataas na cholesterol, posibleng kumipot yung daluyan ng dugo sa mga paa natin, kaya nagkakaroon ng decreased blood flow, peripheral vascular disease, tapos later on, pag lumala, halimbawa nagkasugat, nagkakaroon ng poor wound healing and other infections. No? Dahil din sa, una sa lahat, mataas ang blood sugar, madaling kapitan ng infeksyon, tapos poor na yung blood flow, so hindi masyadong makaabot doon yung defense mechanism ng sarili niyang katawan para i-heal or para gumaling yung dugo, yung sugat na yon. So, yung increased blood glucose naman doon sa area is a good source of nutrition to microbes or sa mga bacteria at mas madaling kumalat ang sakit na yon. Mas lalaki pa ang sugat, lalo na pangit pa yung blood flow doon sa lugar. So, marami na rin pong mga pasyenteng napuputulan ng paa dahil sa poor sugar control plus baradong ugat sa mga paa. So, paano natin minamanage ang diabetes? Earlier, si Professor Yoli, no, she already discussed some diet tips. You can see here the Idaho plate method. It helps a patient visualize how different foods can be proportionally arranged on a plate for different meals. Ideally, sa ordinary normal weight individual, siguro mga 50 to 60 kilogram female, no? And male, mga 60 kilogram to, mga 60 kilogram male, you are supposed to consume 1,200 to 1,500 kilocalories per day. Yan yung sa ordinary male or female standard size na may mild or merong konting activity na naglalakad, hindi sobrang sedentary. 1,200 to 1,500 calories. If for those who are obese or malalaki, no, baka mas mababa pa dito ang kinakailangan para mag-weight loss. But let's go back, no? Kung sa mga 50 to 60 kilogram human being, no? This is a 9-inch plate. Half of that plate should contain non-starchy vegetables. What are the non-starchy vegetables? These are your green leafy vegetables, your pwede rin naman yung mga, how should I say this, high fiber vegetables, pwede naman kamote, but the starchy vegetables that you are supposed to avoid would be your potatoes, no? And of course, on 1/4 of the plate, that's starch. Potatoes would be part of the starch, and that also includes the rice and other forms of carbohydrates. So yan, 1/4 lang ng plate would be the starch. So that's about, minsan, 1 cup of rice would be enough. That's about 200 kilocalories, from the 1,200 to 1,500 calories. And 1/4 of the plate should contain protein. Ideally, your protein should be white meat. Now, what are the white meats? Your chicken breast, the fish, it's really not the red meats. Kasi you have to limit the red meats for these patients because of the higher risk for atherosclerotic cardiovascular disease, yung mga cholesterol, at saka higher risk for cancers among diabetics. On the left upper portion of that square is the fruit, and make sure that the fruit would be hindi yung masyadong matamis. Remember, you have a meal already, and if it's a high fructose fruit, yung sobrang tamis, nag-add on ka na rin sa sugars mo. And then on the upper right would be your non-fat milk or yogurt. But remember, you also have to take lots of water. If you don't have milk, water. Because you can get your calcium from your non-starchy vegetables already. So moving on from diet, there's also exercise. You have to warm up and do some stretching before exercising. That is to increase blood flow through the muscles. You have to exercise for 30 minutes 3 times a week. It doesn't mean na tuloy-tuloy yung 30 minutes yan. Pwede naman hati-hati, no? 10 minutes, 10-minute intervals in a day, 3 times, no? So that's 30 minutes already, at least 3 times a week. Mas maganda kung 5 times a week, minsan daily, pwede na rin. Cool down after exercise, drink water, and wear appropriate clothes and shoes. Ayaw natin sumakit ang katawan after exercising. May iba dyan nagli-leave after exercise. It doesn't make sense. Anyway, so there. So for exercise, for those who have newly diagnosed diabetes, you have to check your sugar before and after exercising, know the signs and symptoms of low blood sugar, and have light snacks if needed. For those who need to lose weight, you can take your calories after exercising habang medyo mabilis pa yung metabolic rate nyo para ma-burn nyo kagad. Time your exercise according to your capabilities. We all know that exercise is medicine, so there are different types of exercises for different ages and different patients with chronic diseases. Merong ibang exercises for those with asthma, for those with arthritis. Consult your doctor before undergoing strenuous exercises, especially those with hypertension and poor heart condition. And right now it's so hot, so you have to take in lots of water. Baka kasi tumaas ang blood pressure during exercise due to dehydration lang. So what are the different types of medications? Of course, I mentioned earlier that among type 1 diabetics, insulin lang. Insulin is the way. For type 2 diabetics, they can take oral medications or insulin. And there's another injectable, those are the GLP-1 receptor agonists. Medyo may kamahalan siya, but it is also injectable. It's not insulin. So consult your doctor. After 2 to 4 weeks after your first consult, you have to follow up with basically with new lab results, I guess, or with new CBG or blood glucose monitoring. And then follow up every 3 to 4 months after, depende on what your doctor says. Because in some cases, for those patients who don't have a glucose meter at home, we ask them to do the fasting blood sugar or the random blood sugar and come back for us to be able to adjust their insulin shots. Or if the patient can adjust his own insulin depending on his glucose monitoring, that will be best. So we also teach that to all of our patients. And more frequent consultations may be needed. Early prevention is important to avoid complications. So that's my last slide. Thank you for listening. Do you have questions? Here are questions. From Maris of Malate, ano po ang pwedeng gawin pag bumaba ang blood sugar? Pag bumaba ang blood sugar, you have to take in sugar also, not really fat. Yung iba kasi akala okay lang yung chocolates na. Mas magandang drink na halimbawa regular Coke would be enough. regular Coke in can, that's enough. That's about 50 grams of glucose already. They can take a candy, may hard-boiled candies. Pero yung candies na to, make sure na yung older individuals kasi baka mabilauhan. So yon, mas maganda, or a tablespoon of, 3 tablespoons or 2 to 3 tablespoons of sugar i-take ng pasyente para tumaas ang blood sugar ng konti. Ideally, that will increase your blood sugar by 50 milligram per deciliter. You have to check the blood sugar after you give these sugar-containing substances, at least an hour after. From Kathy of Makati, ang pangangati po ba ay sintomas ng diabetes? Yes. Pangangati all over the body. So, yan yung tinatawag na diabetic neuropathy, no? Parang tumutusok-tusok, minsan hindi pangangati. Parang may gumagapang na langgam. Yan yung ibang description. Meron din sa paa, parang may gumagapang na langgam na hindi nila naiintindihan. Pero, since Kathy is a girl, I hope, pangangati din sa ari kasi pwede mangyari. So, ito yung mga pasyenteng na-diagnose na mga UTI o kaya may vaginosis, yung merong parang fungal infection. Kasi pag umihi ang diabetic na poor ang sugar control, gustong-gusto yan ng bacteria at ng fungi at makatiyan talaga. So, you have to consult your gynecologist and your endocrinologist for this. Pakuha na kayo ng blood sugar. From Tonsky. Bakit bawal ang mangga? Bakit bawal kumain ng mangga pag may diabetes? Yung hilang okay lang naman. Yung hinog, kontrolado, no? Mataas po yung sugar content ng isang mangga. Actually, it's more of mataas ang fructose content the more hinog the mangga is. So, medyo sobrang taas ng blood sugar. You can try it on your own kung normal ang blood sugar mo, no? Check mo yung blood sugar mo 2 hours after eating mangga. Tatasin. Ito yung mga hinog, ha? Pero yung green, promise, okay lang siya. Mas mataas actually yung fructose content ng mga lakatan per gram versus the manggang hinog. Yung iba, inaalaw namin na tama, okay lang yung 1 cheek. Pero yun yung mga medyo maganda na yung sugar control. Pero pag pangit pa, nightmare yan sa doktor. From Gary of Mandaluyong, ang diabetes po ba ay forever? Oo, yung love hindi, pero diabetes, may forever. Forever ang diabetes, pero nakokontrol siya. Nakakontrol to the point na pag maagang na-diagnose ang diabetes, kung minsan yung pasyente pwede maybe off of the medications for about a year, and that's what you call diabetes in remission. Lalo na pag medyo bata-bata pa yung pasyente at nagkocontrol pa ng diet and exercise. Diabetes the diagnosis is forever, but the control kailangan maybe without medication. From Mirna, Presensya, ano po ang pwedeng gawing palaman sa tinapay pag may diabetes? First of all, yung tinapay mas magandang sugar-free. Okay? Hindi, magandang palaman, you can take your tuna, no? I tell my patients to stay away from processed meat, no? Usually mga cold cuts, no? I tell them to stay away because these are dangerous, no? Kasi may preservatives din siya na posibleng makakause ng cancer later on in life. Maganda sana make your own palaman. Don't just buy from out there. You can use tuna. You can use chicken breast. You can make your own sandwich. Gawa ka ng, ito substitute the mayonnaise. Kasi ang mayonnaise high in fat din yan. Remember, when you make mayonnaise, that's oil and egg yolks. Mataas din sa fat. So you can use a substitute yogurt, non-fat or plain yogurt. And then you mix it with chicken or chicken or tuna or whatever fish, okay? And then also you can put in a lot of vegetables. You can put tomatoes, you can put lettuce. It's a matter of being creative. From Carlo of San Juan, ang bakuna po ba ay kailangan para sa mga diabetics? Oh yes, importante po ito, lalo na sa mga older individuals, no? 50 years old and above. Kailangan ng, even dalawa ang kailangan ng pneumonia vaccine sa mga diabetics also. Isang panghabang buhay at isang every 5 years, may flu vaccine din. Kasi nga po, maraming nauospital na mga diabetiko dahil sa pneumonia. Kailangan din nila ng bakuna nung iba kung merong nagkaroon ng herpes zoster o shingles. So, importante ang bakuna sa lahat ng mga diabetiko as early as possible. From Susan of Cubao, ano po ang sintomas ng mababang asukal? Kuminsan walang sintomas. Pero sa mga may nararamdaman, halos pareho yan sa mataas na blood sugar. No? Pagkahilo, parang sintomas na gutom, pinapawisan, yan yung tinatawag na diaphoresis. Kuminsan parang nasusuka. Pareho sila ng sintomas ng hyper or mataas na blood sugar. Pero ang mababang asukal ay mas nakakamatay kaysa matataas ang blood sugar. Kaya importanteng ma-orient, lalo na yung mga pasyenteng nagsushoot ng insulin. From Rafi of Quezon City, pag naka-insulin na po ba, pwede pang mabalik sa tableta? Yes. Hindi lahat ng pasyenteng naka-insulin, mag-i-insulin for life. Kung minsan, inuumpisahan natin po yung insulin sa mga pasyente para makapagpahinga lang yung pancreas nila o yung lapay. Kasi pagod na po yung lapay sa kaka-release ng insulin para mag-sugar control kung sobrang taas. Pag medyo nakapahinga na, naka-replenish na ng insulin sources, pwede na siyang tanggalin. Kung minsan, ini-insulin po natin yung mga may sugat sa paa, yung mga diabetic foot, para mas mabilis gumaling. Kasi may anti-inflammatory effect din yung insulin. And healing effect. Binibigyan din natin ng insulin yung mga pasyenteng may TB. Kasi pagbigyan po natin ng mga oral anti-hyperglycemic o yung mga tableta na iba, posibleng lalo silang pumayat, no? And they need to gain weight. And insulin helps in gaining weight for TB patients at saka mas madaling gumaling yung mga pasyenteng may TB with insulin dahil nababawasan ng inflammation sa area. Nakakahawa po ba ang diabetes? Hindi, pero kung yung baong pamilya mali yung dieta, lahat kayo magkaka-diabetes. From Mel of Manila, okay po ba ang diet soda sa mga diabetics? In moderation, everything is gonna be okay. Pero remember that some diet sodas contain caffeine. Ito yung mga dark sodas. They always contain caffeine. So the tendency is patients would tend to pee a lot. Ihi sila ng ihi. Pag na-dehydrate ang pasyente, tumataas ang blood sugar. So in the same manner, sa coffee, ganun din, in tea. So careful lang. So, pag nag-diet soda, uminom din ng maraming water. Ihi ka nga lang, may ihi. From Chona, Pintor, kung may diabetes at nagtuturok ng insulin, bawal po ba uminom ng beer? Shucks, ang hirap sagutin ito. Dahil nagtatrabaho ako sa San Miguel Corporation. Madi-dehydrate kayo pag nag-beer pa kayo, tapos tataas lalo. Well, madi-dehydrate kayo. Pero, ang effect kasi ng alcohol is that pwedeng bumagsak yung sugar, lalo na in the morning, baka mag-hypoglycemia. So as much as possible, kung naka-insulin, avoid beer. Or make sure na i-monitor yung blood sugar sa madaling araw, sa umaga, para hindi kayo mamatay. From Myra of Makati, pwede po bang kumain ng maraming prutas sa mga diabetiko? You cannot live on prutas. Fruits and vegetables, pero yung prutas, mamili po tayo, hindi yung matatamis. Kaya nasabi ko kanina, hindi pwede yung manggang, masyado yung manggang hinog, tapos yung mga atis, yung isang, kasi hindi lang naman minsan, hindi lang naman isang pirasong lansones ang kakainin nyo. Yung minsan, kalahating kilo, taas ng sugar yan. Hindi lahat ng prutas pwede. So, ano pwede? Pwede kayo mag-apples, pwede kayo mag-peras, pwedeng suha, mga ganon. Pwedeng manggang hilaw na hindi nagbabago. Okay, from Trisha of Paranaque, gaano kadami lang po ang rice na pwedeng kainin? Mahirap sabihin, depende sa body makeup mo, no? Remember na 1,200 calories per day for females ito. So, remember na 200 calories ang isang cup of rice. And 110 calories, kalahati ng 110 calories. Tapos, remember na kanin is carbohydrate. Hopefully, yun lang yung carbohydrate mo. So, pwede ka siguro mag 3 cups of rice in a day. 1 cup of rice per meal. That's 600 kilocalories. Kung yun lang yung carb mo at saka i-burn mo kagad. Mag-exercise ka. Kasi pag hindi kayo mag-exercise, yung carbohydrate na yon o yung kanin na yon magiging taba din. Kung hindi mo siya i-burn agad. So, hindi lang po rice yung culprit sa Pilipino po kasi kung minsan may pansit na may kanin pa o kaya may pansit may tinapay pa. So, remember, it's not just rice, it's the carbohydrate in itself. From Mary of Laguna, maganda po ba walking sa diabetes? Oo naman. Walking, running, exercising, any type of activity. Actually, we encourage everyone to do short incidental physical activities. Yun yung in shortcut, SIPA, short incidental physical activities, meaning in the middle of everything, in the middle of this, like ito, nagsasalita ako, pwede kong tumayo na lang bigla para maglalakad-lakad, no? Halimbawa, also, kung sa office po tayo, pwede tayong mag-use ng stairs instead of the elevator up to a certain floor and then use the elevator kung sobrang taas na. Pwede rin kayo, halimbawa, yung discourage yung mga upuan na may gulong, halimbawa, para kumuha ka ng tubig, tumayo ka naman, huwag ka magpagulong-gulong sa office. Kaya kailangan tumayo. May ibang kumpanya actually na may every 2 hours or 3 hours, ina-encourage lahat na tumayo, walk around or exercise for 1 minute para medyo you lose calories by moving. Galaw-galaw lang. Maganda yung exercise. Like, make it a point. You don't even need to go to the gym. Just exercise even before you go to bed. You can do some stretching exercises in bed. So that's it. That's the last question. And have a great day ahead.